Hi, Paul Sakis. Good news broadcast. We're going to talk about a great gathering. The largest HIV conference underscores continued innovation in HIV care. And we're doing a show upcoming here for the International Day of Peace. And that show, we're going to give a tribute to Dionne Warwick. And Dionne Warwick, many years ago, along with Elton John and Stevie Wonder and Gladys Knight, sang "What Are Friends For?" And I think that that's 30 years ago. I think that's what we're going to talk. We're here with a renowned doctor, Dr. Harmony Garges. Hi, doctor. How are you?
Hi, I'm doing well.
Good.
Thank you for having me.
You're the Chief Medical Officer at viiv. Is that how I say that? ViiV?
Yes, viiv, that's correct.
Healthcare. Okay. So, HIV has been around for too long. And but we see a lot of ads on, better opportunities, I think, for people that do contract AIDS. Well, tell us the latest and what's going to be happening at this conference. Thank you for coming on.
Absolutely. First, I'd just like to highlight we've made tremendous advances in HIV care since HIV first was diagnosed in the 1980s. So we've had 40 years of HIV therapy. Remember, in the beginning, we didn't have medicines to treat HIV. It was often a death sentence for people. Many people died of HIV. Then we developed medicines to treat HIV, but they required people to take multiple pills multiple times a day in very complex regimens. So much so that patients would have to use an alarm clock to set it to remind them when to take which pill. We've continued to make advances, and so if you fast forward to where we are today, we have evolved to a point where most people living with HIV can treat their disease by taking one pill one time a day. Although it's important to remember that these pills, these fixed dose combinations, are combinations of 2 or 3 different medications, but nonetheless, massive advances in HIV care.
And there's different kinds that are out there. Is that so?
That's correct. There are multiple medicines to treat HIV. And so what we talked about at this conference last week in Montreal was some of the new science, some of the new research that was coming forward in terms of some of these treatment advances.
So what is some of the new science that is coming out that then would a company like yours would take into consideration in the process of creating, medicines?
Yeah, so there was a lot of great research at the AIDS conference in Montreal last week. I'd like to highlight 2 different research studies that were studies of the medications that we make at viiv Healthcare. The first one is called Dovato. Now, Dovato is one of those single tablet regimens that I referenced in the beginning, and it's a single tablet regimen that has 2 medicines to treat HIV, not 3. And we did a study in older people living with HIV, asking them, how do they like taking this medicine compared to other types of HIV medication? And we found higher rates of treatment satisfaction with the 2-drug regimen compared to other HIV therapies. And this research is so important because it really brings that patient voice into the conversation, and that's critically important. The other research study was on a medicine called Rukobia. Now, Rukobia is used in people who have been living with HIV for a long time, who have limited treatment options and often multi-drug resistant virus. And we presented 5-year clinical trial data from the study of this medicine showing that even in this patient population of people who are very difficult to treat, this medicine continued to suppress their virus and continued to improve their immune cells over a 5-year period. So again, a really important and impactful study for people living with HIV.
Okay, and the best is to also to speak to your doctor about, how to move forward with things like this?
Absolutely. So it's always important to engage with your physician or healthcare provider in any type of medical conversation for many reasons. One, for education and to learn more, but also to remember these medicines, like all medicines, have side effects. And so we want to make sure that people have that informed conversation with their physician and can decide what medicine is best to treat them.
So let me ask you a question. You're a doctor, and I just did a urologist interview, okay? for some getting older scenarios in my life. Okay. And so, but one of the things that did come up in that conversation was, and I maybe even brought it up, intercourse. So intercourse, the doctor, the urologist, Dr. Kaufman, had said, and I sort of knew this, but I don't know if everybody knows this, so I'm going to bring it up here, that after intercourse, a man should go to the bathroom right away, and a woman should go to the bathroom right away, and go to the bathroom a lot, if you can, to hold it in before you have intercourse. Do you have any thought on that? Because I think possibly, me personally, science is always wonderful, and wondering. We have prostate cancer, we have sort of, ladies' concerns. What do you think? If you don't mind me asking.
Well, I don't mind you asking, although it's not my area of expertise. So what I would comment, though, and I'm really glad you brought this up, intercourse is, of course, very important and a key question that we get for people living with HIV. And the most important message that we can get out there to people is, if you're living with HIV and you're on medicines and your virus is suppressed, we talk about a U equals U message. And what that means is, if your virus is undetectable, you are untransmittable. Really great data to support that. CDC aligns behind that U equals U message. So I think it's important in this interview just to say, for those people living with HIV, take your medications, get your virus under control, and remember, U equals U.
Okay, well spoken, well thought through. I appreciate that information, and thank you for the opportunity to speak with you. Can we learn more somewhere about what we're talking about here now?
Absolutely. Yes, there is. So please talk to your doctor if you have questions. We also have 2 websites. If you want to learn more about the medicines that I talked about today, you can go to dovato.com and racobia.com to learn more about these medications.
All right, Dr. Harmony Gargis, I love your first name and your last name, but the harmony is beautiful. If we're in harmony, then it's you and us, and we're all together now, and what are friends for. Thanks so much. I appreciate the opportunity to talk to you. Bye-bye.
Thank you for having me.
Bye-bye.